and welcome to the MedSynapse podcast. I am Dr. Simran, your host, and today we have Dr. Smily with us. Dr. Lock is a certified family physician and an expert in telehealth and remote monitoring. She has a wealth of experience in integrating these technologies into clinical practice, and today she will be sharing some invaluable insights with us. Dr. Lock, thank you so much for joining us.
Thank you. I'm so humbled by your introduction. I have just some experience in my practice, in clinical practice, as well as in my previous experience in a startup. So yeah, I hope to share my knowledge with everyone tuning in today. Thank you for having me.
Okay, so let's get started by talking about Singapore, where you practice, and how has telehealth evolved in your country of practice?
So I've practiced I'm a family physician practicing both in private and in public currently. I have experience on both sides. So in telehealth has started way back, if you include phone calls to patients in between actual consultations. But only in the recent years where we had video calls. Around 2017, some private companies sprouted out in Singapore. Some big digital platforms like Dr. Anywhere, SpeedDoc, Whitecoat. These are some of the big telehealth companies that sprout out. And they didn't really get much traction until, of course, COVID. That was an extreme event that really helped all these companies flourish, because there's all these stay-home measures as well as circuit breaker in Singapore, whereby everyone had to stay at home. So consultations were brought online. In the public sector, there were platforms that were utilized as well to start all these telehealth consultations to replace non-urgent visits and things like that. And since then, it has just been increasing in terms of the use of telehealth. Many more companies have come up, and also in the public sector, the use of telehealth has expanded beyond just chronic care. Now, even for acute care, even for triaging, there's many users of telehealth in Singapore now.
That's nice. And it's fascinating to hear about the progress in Singapore. So, what recent advancements in remote monitoring have made the biggest impact on chronic disease management?
So, in terms of chronic disease management, there's really been quite a big steps, because we're talking about long-term monitoring and monitoring of data, monitoring of patients' conditions over a long period of time, right? They have been really assisted by new devices that also allow data to be uploaded onto software, onto platforms. So just an example each, right? In the public sector, there is a nationwide project called the National Steps Challenge.
Okay.
So it's actually a initiative from the government to actually encourage people in Singapore to reach 10,000 steps per day.
That's nice.
Okay, so these steps, it's not for fun. Well, you can do it for fun, but actually the intention behind it is that there's data, very strong data, to show that reaching that number of steps can reduce morbidity and mortality rates. So based on this National Steps Challenge, they actually give out a lot of these steps monitoring pedometers. And on top of that, if you have Apple Watch, you have your own, sports watch, Garmin watch, all these watches can link to their system to join the National Steps Challenge and to help get points, track your steps and all that. So that is pretty advanced. We're talking about population-wide measures to actually empower patients or even people to actually use such wearables to monitor their own health. And these are also very useful in terms of this is just an example, right, of preventive health. Specifically for high blood pressure, there is a nationwide hypertension monitoring movement as well. So what is hypertension, right? Hypertension is high blood pressure. And to monitor all these people with high blood pressure, they actually get everyone to either sync their blood pressure machines onto a software or actually update through forms or through an app into a system whereby they can capture the patient's regular blood pressure, capturing the timing of it, the level, the heart rate, and things like that. And all this data throughout these patients are actually captured through the central system, where they can see all this data and actually sift through which are the ones that are maybe higher than normal, consistently higher than normal, or way too low. This will trigger an alert for a team of nurses who are actually trained to look at these blood pressure data and trigger a call to check up and say, hey, your blood pressure is a bit high. You might need to, go to see your doctor a little bit earlier. Yeah, so these are just some ways to sort of, band each patient according to their regular blood pressure readings into this central system. There's an entire operation, and through this, right, we can it's very, very powerful to actually monitor blood pressure at scale. Like we're talking about thousands and thousands of patients.
Definitely. And it is rarely of use for the doctors, the data that is being collected on a daily basis, because they might not have to figure it out by various tests, whenever the patient suffers an attack or someone is having an anginal attack or maybe a myocardial infarction. So they might have the records with them that is the patient, when did the patient had a spike in his, blood pressure or whatnot. So everything is monitored, and that's the beauty of the technology that the doctors can actually incorporate in their practices, and even the patients will feel blessed about it, that yes, definitely it's helping.
For sure. Exactly, like what you said, it's really the data collection that is really very important, and it can be tracked in different ways. And it also empowers patients because they are the ones actually monitoring their blood pressure and submitting the data. So that gives them, the owners to actually take charge of their health. Although we do have to take note of certain concerns. I mean, as much as these are really big movements towards, improving chronic disease in a population level, there are few things that we, that can't be ignored in terms of data protection. So in Singapore, there's a PDPA, there's a Data Protection Act, whereby patients' data needs to be at a certain level of security in terms of their storage. Even a few years back, there was a national hack of some records in major hospitals, and that was with this kind of breach, it is very, very dangerous. We're talking about very sensitive health records, and so like breaching some of these to avoid breaching some of these data protection laws and bylaws, it's very, very important to make sure that the platform that is sent, that this data is sent through, or whichever apps are developed, has to be extremely secure. Yeah.
Because it is a great responsibility that evenly the security system should be in charge for this, because again it is like it is very important to have a hold of all these data, but at the same time the responsibility comes along with that. So
for sure. And there's an additional concern, if you think about it, not all clinics are actually 24/7. So if the data is submitted at in the wee hours of the day, in at the night, and these are extremely abnormal readings, whose duty it is it to track such abnormal readings, right? It technically, if there's no mechanism to actually trigger an alert, even outside the hours, it can potentially bring into an ethical concern. Hey, actually, whose duty of care is it to take care of this abnormal reading? Yeah, and it can be potentially worrying if this is not flagged up, or if there's no mechanism to flag it up.
Yes.
And on top of that, sometimes patients can be anxious, hey, is my reading, correct? Or, what should I be doing? And, it might add to anxiety of patients. So it is, it's not all a bed of roses. These are concerns that need to be addressed as well.
So these are the great challenges, as you have mentioned, because I think the government might be working on this as well. As you mentioned, that the Singapore government is directly involved in all of these things. So the ethical considerations, it may be as you mentioned, the doctors are not available at some time of maybe the odd hours that they are not actually working at that time. So it can be flagged at that time if the patient is having any kind of distress or something. That is again a challenge that you have mentioned. So any such more challenges you think that teleconsultation needs to overcome in order to bring it in a better way?
Of course, in that sense, telehealth, as much as it is a tool, actually a wrong use of it could lead to adverse events. Let me give you an example. If someone is having an acute heart attack, or acute myocardial infarction, unfortunately, as much as we want to use a quick and fast way to get in touch with someone, instead of calling, if you are calling a telehealth provider instead of an ambulance, there is actually a chance of delaying care. Because what can a telehealth provider do virtually, right? That could delay actually the transport of the patient to the hospital for a balloon, an emergency PCI, or a stent. These are actually time critical moments, and it is quite important in terms of the use of it, in that it should actually be ring fenced into certain level of cases that are not medical emergencies that actually need immediate physical attention. For example, even bleeding, massive bleeding.
Yes.
A telehealth doctor could give very basic first aid advice, but unfortunately, if in such severe cases, getting the patient to the hospital for emergency care could be even more life-saving than a telehealth consultation. So that is just the use of it could be a big challenge, to actually educate the users of these platforms to actually use it in the right way. I've also come across a challenge in that, unfortunately, telehealth, it is virtual after all, so it actually leads to an incomplete assessment. And what do I mean by that? If someone needs a check on an abnormal discharge or an abnormal lump, unfortunately, these are actually complaints that actually need a physical examination in person. A more thorough examination. For example, examination of the intimate parts, or actually feeling the lump, feeling the whether certain features of it. These are some things that it is very, very difficult to convey to a patient without the proper knowledge of how to deal with it. So it can lead to incomplete assessment. So that is these are more of the medical, medical, legal, or medical, clinical aspects of it. If we think about the operation related challenges, right? Actually, it is quite important that the infrastructure in terms of the telehealth can accommodate the load of patients.
Yes.
For example, in terms of the network, in terms of the patient data, these are some things that has to be taken into account when starting such a service. For example, if I'm in a practice that doesn't allow for integration of my computer management system, my clinical management system, to this video platform, unfortunately, there might be some disconnect in terms of the patient's data, in terms of how all these things are transmitted through. And so these are quite important operational related things. I think accessibility is one thing. In one of my previous practice, it was actually in the heart of a very old neighborhood, where the average age of patients that I see are between closer to mid-70s to mid-80s, 90 years old. People who are coming in might not be English speaking. They might be speaking multiple dialects. They are more elderly, so there's higher chance of them having hearing issues, vision issues, and not even owning a smartphone. So in terms of that accessibility, this could be an issue if your practice is around a patient pool that is not that literate in terms of
language barriers or maybe literacy as well.
Yes, correct. So both health literacy, digital literacy, these are important factors in terms of like the accessibility to such services.
Yes.
Exactly. So yeah, so that's for one. Yeah.
These challenges are
very challenging.
Because if at all they are improved, then definitely the system is the best system we can consider, but if not, then
yes, correct. And on top of that, in terms of the business aspect of telehealth, it's also quite a challenge. Recently in Singapore, there has been a crazy competition in terms of the price point for telehealth. Previously, telehealth used to be maybe priced at about $20 Singapore dollars, which is maybe about 15 US dollars. But now it has come down to even reportedly $16, $8, even $1 consultations in terms of the marketing. And I'm not too sure how this price war can be sustainable for both the business and also the service. In terms of the quality of the service, it could be quite challenging if your practice has to compete with other players who are playing the volume game, and patients are price sensitive, so it is quite difficult when these big entities are using such pricing tactics. So if the price can't account for the operational cost, it can be very challenging for a practice to actually adopt this telehealth service into a regular practice. So these are some of the things that I have come across in terms of challenges.
These are really the challenges, I guess, which most of the clinicians as well as patients on both the aspects since you talked about. Because the clinicians, as you mentioned, that it's way costlier, not that affordable for all the clinicians to adopt to this. And most importantly, for the patients as well, because sometimes they are not that literate enough, the technological aspect I'm talking about. Maybe the language is again a barrier for many areas. If I talk about other countries as well, if something is developed in Singapore and they are only talking in English, then other regions might not get the benefit out of it. So this is actually you have pointed out the challenges which one can't even think of at the moment. But yes, it is a big challenge. So moving ahead with this, how do you see artificial intelligence enhancing remote monitoring and telehealth?
To be very frank, artificial intelligence has not reached that mature state in terms of healthcare. Why I say that is actually artificial intelligence, as with any data, will have to comply with some of the data protection laws as well. So currently the artificial intelligence are more for commercial use, are more for even scribing and things like that. And unfortunately, even some of these platforms who do scribes, let's say scribing for a doctor who is writing a referral letter or writing a clinical note for a patient, one has to ponder who is actually running the platform that is capturing this data. For example, if I'm using such an application that uses artificial intelligence in a practice in Singapore, with this app that is, for example, in India or in US, how can we reconcile that the patient's data has actually traveled across the geographical boundaries of the clinical practice?
Yes.
And who is protecting the data in that? So currently, artificial intelligence has not really been that mature in having the infrastructure that is actually secure. But in the future, if there is more of such mechanisms in terms of remote monitoring and telehealth, there could be many uses. For example, in terms of analytics, if in terms of telehealth, if there is a triad symptom, meaning I've come for cough, this one come for headache, this one come for tummy pain, headache, cough, and runny nose, and if you gather all these data points in terms of their presenting complaint, you can actually run some sort of analytics in predicting what is actually maybe the medication that is used for this consultation, and assist the practitioner in prescribing, or even writing the notes for this patient. And I use the word assist, not to replace, right? Artificial intelligence, as powerful as it is, it could hallucinate as well. It could hallucinate in that creating false information or filling in the gaps that is actually untrue. So those are some things to think about. On top of that, in terms of remote monitoring, even the example that we used earlier in terms of blood pressure monitoring, how much blood pressure could predict when should be the next follow up to the doctor. So let's say if it's beyond a certain range, can this artificial intelligence capture this data and prompt to the owner of this platform that, hey, your patient has this range of blood pressure and I may suggest that you see within 2 weeks, for example. And that could guide the user to actually make clinical decisions based on some of these data or suggestions by artificial intelligence. Yeah, so if all that, if the system becomes more mature, perhaps we can move into that kind of usages.
Yes. So AI again, since as you rightly mentioned that it is not the right time, I guess, to use this into our practices, into our daily practices, but definitely in the future it might be developed that way, or maybe we need to take some classes for this, because again it is like we need to again understand that yes, this is actually going to help us, and then what prompt should we give so that it helps us in a better way, because again prompt is the main thing that we need to understand for this.
Yeah, exactly. Yeah, it is exciting to see what unfolds. I mean, even 10 years ago, we wouldn't know that telehealth would become mainstream. And now it's really everywhere. It makes things more convenient. It's more mainstream, it's more accepted. So, we don't know what will happen in even 5 years' time. Yeah.
So finally, for our fellow physicians who are considering integrating telehealth into their practices, what advice would you give them?
Well, especially if you're trying to integrate telehealth into your own practice, be very, very sure of your country's telehealth guidelines. I would say, especially in Singapore, they are very clearly spelled out in terms of what are some of the requirements in terms of conducting a telehealth service. For one, your clinic license has to have has to be accredited for telehealth under the HCSA, Healthcare Services Act, and you have to register it with including the telehealth portion. Unfortunately, if you don't actually take or accept that as part of your service, you're not allowed to actually perform a telehealth service at your practice. So that part is pretty important. And even if you have accepted that, there are specific guidelines that is required. Of course, in terms of secure data and things like that, those are very simple requirements of many others. And the other thing is the practitioners need to take a telehealth certification in Singapore, meaning just a short course online to actually show that you need to fulfill some of these requirements. For example, every teleconsult needs to have certain boundaries. It has to start with patient identification, with the patient ID as well as full name, and even on top of that, where is the location of the patient. In case the patient is in a location that is at home or at office, it needs to be a place that is verified, such that if the teleconsult gets interrupted halfway due to an emergency, the ambulance service can be rendered straight into that location that patient mentioned. So, these are some of the basic requirements that is encompassed within the telehealth certification, right? And of course, last of all, is to really integrate this telehealth service into the practice to make sure that it is a secure portal. I mean, I can't emphasize that enough. There has been hackers nowadays have very sophisticated tools to actually breach some of these privacy laws. So it is extra important that all this information is secure. So yeah, hopefully with all this in mind, hopefully your practice would be something that is more robust, is more all-rounded, that patients are able to access the medical services in face-to-face and also teleconsult.
So that is again an enlightening insight that has been shared by you, Dr. Smily, today. And before we conclude this session, I would want you to, speak few words regarding the MedSynapse platform, because I would want to know that how your journey has been up till now, and how do you find this platform to be benefiting the doctors out there?
Oh, I find this to be a very fruitful platform to actually integrate some of these ideas into our daily use. As doctors, sometimes we might work in silos, or we might work within our own place of practice without actually opening up our minds and our hearts to some of the other doctors who have an alternative practice, and using some of these practices. Just really imagining some of these into your own practice could push yourself to be a better doctor and to give better service to patients.
Yeah,
So
absolutely.
it's a great job. It's a great job.
Thank you so much. And that is really, it was really an enlightening conversation. And I'm sure our listeners will benefit greatly from your insights. Thank you so much, Dr. Locke.
Thank you, Simran. Thanks for having me.
And thank you to our listeners for tuning in. We hope you found this episode helpful and informative. Stay tuned for more such discussions on the latest in healthcare. Until next time, take care and keep advancing in healthcare. And even if you are a doctor who would like to share your insights on our MedSynapse platform, please contact us. Thank you so much.